take this opportunity to talk about about COVID-19 and where we are as a community, provide you with an update and some of the things that we've already done and where we are moving forward. We know this has been a tough time for all of us in the community, in the hospital. It's been very interesting and very challenging. It was just about a month ago, March 21st, when we saw our first confirmed case of the COVID-19 in Hazleton. And so it really wasn't all that long ago, although it seems like it's been a little bit longer, but it's only been about a month. And Dr. Edmonds and Dr. Lenko really spearhead and lead our outpatient testing centers in Hazleton. And as we began and continued testing, we were starting to see some things that were concerning. One is we were seeing a high number of positive cases in Hazleton. And they came to me and said, this is something we need to do something about. We're just seeing an increase in the number of positives, specifically in Hazleton. And so what we did immediately is we got together a number of community leaders in the Hazleton area: Senator John Udicek, Representative Tara Toohill, Representative Jeffrey Mullery, and the mayors of Hazleton, West Hazleton and Hazel Township. We also included the Chamber of Commerce, the United Way, and we got on the phone to accomplish a few things. One is we wanted to make sure that our community leaders were well aware of what was occurring in Hazleton and what we were seeing at our testing sites. We also wanted to talk about some of the initiatives that we thought we needed to implement and talk about some of the areas of opportunity for us to flatten the curve. We've all heard that term before. And so we took this on and we created a number of initiatives. One is we informed the community of where we are. We're providing daily updates just about the trends and what we were seeing in the Hazleton community. We also wanted to develop a communication plan: stay home, social distancing, wash your hands, and we wanted to make sure that communication plan hit the community, both the Spanish-speaking community as well as the community in general. And so we had a team that was just focused on how we best do that. And we have we implemented a number of initiatives in the communication side. We also realized that where were we struggling with social distancing? And of course, one of the obvious areas that we were struggling with was in the local industries. Very, very difficult to social distance in some of our local industries. And so working with the chamber and our local leaders, we got together with the industries and talked about what they could do and what we could do with them to help us in improving our social distancing. And I will tell you that we've had the support from the local industries, asking questions, sharing ideas. And so I think we've made a great deal of progress as it relates to that. And so I think where we are today is first off, I want to say thank you to our community. You have delivered on the things that we've asked you to do. You have done a great job at improving our social distancing, at staying at home. And I'll tell you, we're going to share where we are today. And I truly think we're on the right road. And I truly think, and I think the physicians in the room will also agree, it has made a difference in the greater Hazleton area. But we will share some information with you as to where we are currently in Hazleton. I also want to say thank you to the community because it's been overwhelming, the support we receive from the various restaurants to just the general community in general, with flowers, with food, with donation of masks. Our community has overwhelmingly supported the frontline healthcare workers, and we are so appreciative of that. Having said all of that, so we're going to share again some information about where we are as a hospital. I want to stress that this is not over. And so we're going to show you where we are today, but this is a crucial time, a critical time for the community as to where we go from here. So we cannot take our foot off the gas as it relates to the social distancing, the washing the hands, the staying at home. They are all still critical for us to continue where we are today, as well as to see that decrease we're seeing currently in our community. So, Dr. Valente, I'm going to turn it over to you if you could talk a little bit about what we're seeing on the hospital side and any other comments.
So, John, thanks. Thank you. Yeah, let me bring everybody up to date with what's gone on and what's going on in the hospital. Currently, we have 22 people in the hospital as of today that are COVID positive. We have noticed we peaked at about 30, and that peak was a little over a week or so ago, and we seem to have leveled off where we are right now. And I'll explain a little bit more about the numbers in a little bit. But we do seem to have leveled off. We've been at this pace here now for about a week or so. We've had a total of somewhere between 80 and 90 total patients admitted to the hospital with COVID-19 disease. And obviously, with having 22 left in the building, we've discharged probably about 70 patients or so. We have had numerous people on mechanical ventilators. I'm happy to say that we have extubated 3 people. Extubated means to take somebody off of a ventilator. We've extubated 3 patients, the last one of which was just about an hour or so ago. So obviously we're excited about that. Folks on ventilators with this disease typically don't do well, and when you can get somebody off, it is a pretty big deal. So we're very happy with that. And our ICU has not been to the point where we have been in any way more or less overrun or pushed beyond our limits. There was a point about a week or so ago where we had a number of COVID patients, and we also had a number of just general medical cases in the ICU that were not COVID related. And so in working with the hospital at Cedar Crest, we did make arrangements to transfer several of our patients down there so that we could take some of the strain off of this hospital. And that's worked really nicely. We've done that over the last week or so, and we've moved some people down there so that we can keep our efficiency up based on our staffing. So that's worked out real well for us. So as I mentioned, so far the hospital has been brisk. We've not been overwhelmed. We've had a sizable amount of people that have been seen at the hospital and eventually discharged. And happy to say that we've had 3 people come off mechanical ventilators thus far, which is, as mentioned, that's a huge accomplishment.
So I just want to add, and again, Tony jumped in. So we've seen the census jump from 1 patient to a higher 30 plus patients, and now we're hovering in that 24, 25 range. That's about what we're seeing now. So that's where we are. Now the question becomes, where do we go from here? Will we see an increase in our census, or will we see that decrease? Will we begin to see the decrease? And so that's why it's so critically important for us to make sure we maintain all of the things that we've worked hard to do, because we're at that point now. Now we're going to see, are we going to see the curve begin to go lower, or are we going to see us increase? And so we're at that point. I think, is that a fair statement, Dr. Valente?
Absolutely. We definitely at a plateau, I guess, of sort right now. You know, we saw the curve go up, we leveled off, and we've been basically plateaued here for, I'm going to say, about a week. Right now, we've been at about the same level, meaning people are just coming and going and keeping the overall number about the same.
So next, we're going to move over and have Dr. Evans, Michael Evans, talk a little bit about what we're seeing on the outpatient and some other areas.
Yeah, thank you, John and Tony. I just want to pivot a little bit and look at this as more of a public health problem that we're dealing with, and you know, For us at LVPG in Hazleton, the work started in early March. We opened our first testing site on March 13th, and then we started to get positives back, and we could see this moving through the community. So the first phase of the public health effort, so to speak, was to assemble the community leaders and do what we could from a mitigation effort to try to suppress the spread of the virus. And that's what we've been doing. That's been the stay at home, that's been the social distancing, that's been the hand washing, all of these things that we've done. And we're still there. We're still in that first phase where we're trying to suppress the rate of spread of the virus. What we've learned over that period is that we've been fairly successful. I think the models that we were seeing even as late as the end of March were suggesting that we might see a very large surge that would overwhelm the hospital capacity. I think what we've learned since March is that by implementing these mitigation strategies, we can bring that curve down, and we've done that successfully to the point where, as Dr. Valente mentioned, we have not been overrun in the ICU, and we've been able to keep up with the demand from all of these sick COVID patients. So, you know, the question now is, what is next? And I think that's what we're struggling with, not just here in Hazleton or within the Lehigh Valley Health Network, but really across the country. How do we get from our maximal mitigation efforts to what's going to become our new normal? And when it comes to that, I think there's probably more questions than answers. I think the first priority is that we find a way to do it safely. And if you know, we're opening up parts of our community, we need to do that in a safe and measured way. Part of the struggle there relates back to testing. And you know, as I mentioned, we've been testing since March 13th. Unfortunately, nobody across the country is able to test everybody who is suspected of having COVID-19. Or what would be even better would be to test even more broadly than that, so that we really knew the prevalence of disease in the community. So what we're left with as a measure for how well we're mitigating is kind of a lagging indicator. We're seeing when patients get sick and show up at the hospital, and so that's about 2 weeks after the community spread is happening. And so that's obviously far from perfect, and it's a challenge both for us in Hazleton and at our network, state and countrywide, to figure out how we either use that lagging metric to inform us as we're starting to open up society, or develop better testing capabilities so that we can test much more in real time. We can track cases, we can track contacts, and we can do things in the safest possible way. So I think that's kind of what we're struggling with, you know, as a network, but also nationally, and the testing is really a key component.
So thanks, Mike. I think I'll kind of piggyback off of what Mike, Dr. Evans has said, specifically about testing, and some of the relatively new information is that the Department of Health has opened up their testing site, also in Luzerne County and Wilkes-Barre. I think today at 12 o'clock was the first patients that they saw. It's very similar to the testing that we are offering, in that it is only for symptomatic patients, and specifically patients that are at higher risk, over 65, and also first responders and healthcare workers. So we appreciate their efforts, because these efforts are a community effort. This is not us versus, this is as many patients as we can get tested in any capacity is what we're looking for. So that was an important point I wanted to make. And then the other comment is just about what everyone else has said about social distancing and continuing to be vigilant, because we know that, as we've said, we seem to have a slight plateau at this point, but I don't think anybody should let their guard down. And I feel that with my patients that I talk to every day. Everyone has accepted that this is a new way to live life, and a new temporary, hopefully, normal. But it's important to make sure you're continuing to minimize, you know, outings out of the house to one person, if at all possible. Wash your hands as much as possible. Wearing gloves is not a necessity. I certainly do not do that unless I'm in contact with a patient. So I don't necessarily think that you need to do that, as long as you are continuing to practice good hygiene with hand washing. The other thing to point out is mask wearing is now mandated when you are going out into the public. And I just wanted to comment on the masks. We have a variety on the table here. all of which are acceptable. Dr. Valente's mask is the appropriate mask for in the hospital use when you're in contact with a known patient with coronavirus. A surgical mask like the one I have here is another option. And then Dr. Evans has a homemade cloth mask. The most important thing with that I wanted to make is that make sure that you're not touching the mask, if at all possible, when you're placing it on and off. You place it over your nose and then only touch the outside and the strings of the mask. That's super important so you don't contaminate other aspects of your hands and other surfaces. I think those were my only comments at this point, but to go along with everybody else, thanking the community for all of their support, and especially for, listening and asking questions and taking some of our advice. We are here for you. We are ready when you need us, and I think that's what we've shown over the last couple weeks, but we hope that this disease goes away quickly so that you don't need us, but we are still here for you.
Just a couple last comments, and then we'll open it up for questions. And so one of the things that we always get asked is what can we do for you? What can we do for the hospital? What can we do for the healthcare workers in the hospital? And I already mentioned so many great things have been done. But I'll tell you the number one thing that you can do for us, and that is continue to maintain the social distancing, the stay at home, the washing of hands, because I will tell you, that's how we keep our healthcare workers safe, is by you doing what you need to do, what we all need to do in the community. And I think I speak for all of us when we just want to say a huge thank you to our healthcare workers, because they have gone above and beyond and have done a tremendous job in taking care of our community, from our nurses to our respiratory therapists to our transport to housekeeping, you name it, food service. They have all been with us shoulder to shoulder in taking care of our community. So we owe them a huge thank you.